So my name's Karen Roberts. I am a physician associate, and I'm fortunate to run the physician associate program at Brighton and Sussex Medical School. So this is just going to be a brief introduction to PAs and what we do and who we are. And actually, how do you become a physician associate? And why might you consider a career as a PA instead of going to medical school or another allied health professional? And if you are going to look at joining a PA program, then what do universities want in their PA students? So the physician associate or physician assistant profession has been around for a long time. It's been in the US for over 50 years. It's been in many countries in sub-Saharan Africa and other locations around the world. The first PAs worked in the UK starting in 2003. So we're still fairly new, closing in on 2 decades, but we're fairly new to the UK. We aren't doctors, but we do train in the medical model, so in the same way that doctors train, and we practice medicine. So how do you become a PA? So first you have to complete a life science degree. Biomedical sciences is ideal, but human biology, physiology, those types of sessions are also very good as undergraduate degrees. Most PA programs in the UK do require at least a 2-1 as your undergraduate award, and a few programs will accept students with a 2-2. And having a master's beyond that generally isn't, it's helpful, but you still have to have that 2-1 as your undergraduate award. And then if you're thinking about applying, you might want to either get a job as a healthcare assistant while you're studying your undergraduate degree or afterwards, or do volunteering, so just so that you have some exposure to what it's like to work in the healthcare industry. And then there are about 35 PA programs currently in the UK, and that's in all 4 nations have at least one program. It's really important to research what the programs offer. They all run slightly differently, and you want to find a good match for you. So I've put a link on here to the Faculty of Physician Associates website, and there's a whole section on becoming a PA. So how are we different, really, than doctors? So in the typical medical school in the UK, if you're looking at 5-year programs, the first 2 years are spent doing a lot of basic sciences. And then following that, students spend about 3 years doing clinical education. So they're on placements a lot. They spend a lot of time seeing patients. After they finish, they enter their foundation years and then progress up from there. And during their time in medical school, they really do look at the breadth of medicine, but also many things to a really significant depth. So PA studies is different in that students already come to us with a very strong science foundation. And so then what we do is we compress about 3 years of medical education into a 2-year program. So they're very long years with a minimum of 45 weeks per year. And we also do the breadth of medicine. So what's really different about PA studies and medical school is the depth that we spend. Our focus as physician associates is on common and important conditions, and we leave those rare conditions and the very complex conditions for the doctors to deal with. Straight after a PA program, we enter straight into employment. So why are we needed, actually? So it's important to add to the skill mix. I think people now realize that doctors don't have to do everything, and that there are many other clinicians who can practice medicine or provide that level of care for patients. And our goal is to bring more people, more different people into the NHS rather than taking from nurses or physios or sports scientists. And certainly we're happy to have people, but what we want are more clinicians because we don't have enough as it is. PAs are very different in that they train as generalists, and we will always remain generalists. So for example, if you become a PA and you work in trauma and orthopedics, you're going to know a lot about musculoskeletal issues and about trauma. However, you will also maintain your generalist skills and knowledge so that if a patient comes in and they have a joint replacement, but they might also have diabetes or other issues, as a PA, we always maintain that knowledge so that we can help deal with the patients with any condition that they come in with. Our education is very similar to medical school, but it is much more condensed. And so it's a challenge, but our students absolutely excel. So why choose a career as a PA? So one benefit of being a PA is that throughout our entire career, we can change specialties. I personally have always worked in general practice, but I have a strong interest in dermatology. And if I were ever to move out of general practice role, I would go get a job in dermatology. And for me, it would be as simple as finding a job rather than going back and getting a training post and spending many, many more years to get to a level of expertise. And so that's really important as a PA that I have that flexibility, but also that's why it's so important I maintain my knowledge across the board. At this point, it's a still fairly new profession in the UK, and we have a lot of students who come to us and say, you know what, I'd really like to be part of something new and be a pioneer. And there is still that opportunity. I came to the UK in 2007. There were about 30 PAs at that time, and now we have almost 2,100. So not many of us still, and it's still a chance to be involved and help grow the profession. And once you start working, once you get out of your training, our work-life balance is a bit better because we join a team. It's stable. We're not moved around a lot. I always have a lot of sympathy for the junior doctors who rotate around a lot in their first few years of their work life. And it's still an opportunity to practice medicine. We're part of the medical team. We practice medicine and we can provide excellent care to patients. So where do we work? When we first started in the UK, we were in general practice and emergency medicine, but now we're in almost every specialty in the UK. PAs are doing great work across the board. And so how do we really help? I think one of the main things is that we can provide greater access to patients. So if you look at this the top bubble where there's a little bit of overlap, and right in the middle, there's a triangle where all three professions overlap. So we've got our doctors, we've got our PAs, and we have our advanced nurse practitioners. But actually, as a PA, my entire scope of practice fits within that of the doctors with whom I'm working. And then the advanced nurse practitioners, part of what they do is practice medicine, but part of what they do still retains their nursing role. And so if you look at the overlap now of the three professions, that's much, much greater in the lower picture. And so therefore patients can access care. They call to get an appointment. It's much easier for them to be seen and to have someone who is appropriately trained take care of them. By having a PA in the team, it also, because we can do a lot of many of the same things that doctors do, but it allows the doctors to really focus their time and attention on those most complex patients because they are the ones who have that added level of expertise to deal with those patients. So getting to what universities are looking for when they are choosing students, what I want to see is someone who is really committed to being an excellent clinician. Who is going to be a great ambassador for our profession. So it's coming with a lot of enthusiasm. Absolutely being patient-centered is the most important thing. I always want to say, from day one on our course, it's actually not about you anymore. It's about every single one of your future patients. So we provide a huge amount of support for our students, but everything we do is about patient safety and about helping our students be able to become those excellent clinicians. It's an intense program. The students will tell you themselves. It takes a lot of time. It is not like undergraduate. We don't have sports Wednesdays. And I usually say it's a minimum of 50 hours a week, and the students can let you know how many hours they spent. But it is a big, huge time commitment. But it is 2 years and it's done. The other thing I really want to see is excellent written communication skills. So if I write something in a patient's chart and the next person to see that patient doesn't understand what I'm talking about, that can put that patient at risk. So it's very, very important. And then really understanding the PA profession. What I don't really want to see at an interview for a PA place is, well, I always wanted to be a doctor, but so this isn't a second choice. In many places, getting into, well, certainly in the US, there are many places where it's harder to get into a PA program than it is to get into medical school. And part of that is because the programs are much smaller. And I think we in the UK are developing some outstanding PA programs, and many of them have been running for well over a decade. So it's encouraging to see what's happening in the PA profession. And I think students need to go and look at it. And the Faculty of Physician Associates website at the Royal College of Physicians is a great place to start. So really, what I want you to take away from this is PAs are here to help provide excellent care for our patients. And we don't actually take jobs away from doctors or nurses. We're all one team together. We don't have enough doctors, we don't have enough nurses, and we certainly don't have enough PAs. But we all work together to provide care for our patients, and that's the most important thing. And PAs are often provide huge continuity, both for patients and for the team. And so when junior doctors are rotating around between places, PAs are often that stable person in the team who can help out. And that's the end of that presentation. So just open up to any questions that you might have. And also I have, I believe, Naomi Mayo and Tom Cheeseman here, who are two second-year students from the University of, from Brighton and Sussex.
Hello. Hi, Karen.
Hello.
Hi there.
Okay, do we have any questions in the side? So what kind of A-level grades are we looking for? You need to have certainly A-levels in the A through C range, and if you're doing biology, maths, chemistry, those would be ideally be higher, in the higher range. And so A's and B's, although I think they are grading them differently. What's really most important, however, is your undergraduate award. Yes, so the question from Hannah, yes, the A-level grades are important, but actually your award at university is much more important. Okay, and then there's a question about how, so it's PA, physician associate, how do we progress in grade? The vast majority of physician associates, when they qualify, start at Agenda for Change Band 7, and then as they gain experience, they move up through that banding, and there are PAs who are in Band 8A range who are supervising other PAs, working on rotas, that type of thing. Okay, and if anyone wants to ask, maybe Naomi, I can see you. I can see Tom's there as well. Do you, either of you, want to speak for a few minutes about what it was like since you're just coming to the end of your 2-year program?
Yeah, I will reiterate what you've just said, Karen. It is a really hard course. You know, it's definitely not something to go into lightly, and you need to prepare to work evenings and weekends on the course, as well as being at uni for most of the week or on placement. But saying that, it's probably one of the most rewarding courses you can do, because you learn so much so quickly, and you know, it's really astonishing. Everyone's so supportive. Out of all the courses I've ever done, it's the cohort has just been so close, and we've really helped each other through it. And so yeah, I definitely recommend doing the course.
Tom, did you want to say anything?
Yeah, can you hear me?
Yes.
Yeah, okay, great. Yeah, I think I'd echo it's definitely a difficult but rewarding course. I think you need to definitely come in with the right mindset of what you expect to get out of it, what you want to be doing. And as Karen said, don't apply for it as a backup for wanting to be a doctor or wanting to be medicine. Really understand what a PA is and what you want to do. It's probably the best thing.
Great. There are a couple questions on the side. So a public health degree is a policy degree, really important. And I think it's fantastic to have people in the cohort who come with a variety of different backgrounds. But that being said, you absolutely have to have some life science. So if you have a different degree, such as public health or even psychology, you must have some life science. So you can go to Open University or somewhere and do physiology. You have to have physiology at an absolute minimum. And this will be dependent on each course. So you might want to talk to each course if you're considering applying, whether or not they will even accept someone who doesn't have a life science degree. So just think about those. And if you're doing public health, then try to mix other things in, such as the physiology and anatomy if you can. About the work experience, so some university programs do require that and some don't. So it's up to each program. And I think it's great to go volunteer. You don't necessarily have to go get a job as a healthcare assistant, but volunteering and understanding a little bit about NHS is really helpful. Somebody said about applying through UCAS. That's interesting. So the PA Schools Council has just agreed that going forward, whether that's going to be probably for the 2021 intake, most PA moving to UCAS entry, but it isn't yet set up, but it will be moving that way. Age range of applicants. So absolutely suited to older students. I definitely was not straight out of my undergrad. That's the best decision I ever made. And I had a foreign language. My degree's in German, so I had to go back to university and do many science modules before I could even apply to my program. And so it doesn't matter, if you feel like you can contribute. I was in my mid-30s and said, I don't want to do what I'm doing for the rest of my working career. And so if you feel you've got a decade or so past qualification to really dedicate yourself to patients and the NHS, then by all means, I think you should apply. MMIs at some universities, but not at all university programs.
Ruth,
just want to
just going to answer
Ruth's
question. Yeah,
yep.
So I started the course when I was 40, and I'm not even the oldest one on the course. So yeah, there's a wide range of ages, and you'll be absolutely fine if you're a bit older. You might find it harder to remember things, but, but I've managed to pass it.
Yep. Any other questions that we have? The progression in the UK has been really amazing since I got here about 13 years ago. And if you've been looking at the profession at all, you may know that as of next year, we will be regulated by the GMC, so the General Medical Council that regulates doctors. And that's been a huge step for us. And once that is in place, once regulation is in place, then we will look forward to gaining prescribing rights. And that is absolutely expected, that we will be able to prescribe. But at the moment, it's illegal, and it's not a lack of training, it's a lack of the legislation required. So it will happen. It's just a question of when. There's a question about university fees for PA is different, slightly higher than undergraduate. I think every university sets its own fees. There is some funding at the moment. That's by Health Education England. So I'm not sure that it applies to any of the devolved nations. But at the moment, for this year, Health Education England has a training grant of £5,000 per student, and that's split over the 2 years of the course. There's also the postgraduate loan scheme, the government postgraduate loan scheme, which I think is £10,250. So that pretty much pays tuition for the first year. And then some universities give, if they happen to be running it and you've been an undergrad, some programs have a slight discount for their I don't. So the question, Hannah, about whether you need to come from a Russell group, no PA program that I know has those types of preferences. What we're really looking for is enthusiastic people with a very strong science foundation. And so it's not about, in my opinion, which university you went to. What I want to know is that you are enthusiastic and you understand that you're going to be an ambassador. You may be the only person a person meets who's actually a PA or a PA student. And so what we want are people who have, there's no question about enthusiasm, professionalism, going out and advocating for our profession. It's key. Naomi or Tom, do you want to say anything about that?
Yeah, well, one of the things that you'll find you're always asked when you're on your clinical placements is, what is a PA? Because as Karen was saying, there aren't that many of us out there, which will change. Obviously, as years go on, there'll be more and more. And so, yes, you need to represent the profession really well. It's really important. So, yeah, you need enthusiasm and you need to be professional.
Okay, and Tom, did you want to add anything on that? And then I'll address the question from Mukti.
Yeah, I'm definitely so. I think, there is still some confusion from the medical side as to what a PA is, particularly because it's quite a novel new course. But I think that's almost an advantage to us in that really we can go into a department we can show what we can do. We can really find our own niche, or you can really find your own niche in something that interests you. So if you want to work in hematology, work in surgery or general practice, you can really carve out your own area of practice rather than following like a prescribed foundation year 1, 2, 3, etc. that the doctors have to go through.
Yeah, thanks. And that's so true, because I have a strong interest in dermatology, as I said. And so when I worked in my GP surgery, I did all the minor surgery. It was my Friday afternoon clinic, and I just had patients booked in. It was something I did alongside my regular GP work, and I had one of the GPs there to back me up in case I needed help. But that was something I really, really enjoyed. Do students work alongside? This is a full-time course, and when I say 50 hours a week, I see Naomi nodding. Tom's probably nodding too. It does take all your time. And so we do have a few students who work, but this is not a train on the job. So students spend about half their time of the 2 years on clinical placements, but these are not paid placements. It's very different than sort of nursing and other healthcare programs. So you're in class. Most programs have the bulk of year 1 is in teaching, and the bulk of year 2 is in placement. But there are other programs who do that slightly differently. They may do 4 months of teaching and then 4 months of placement. So just think about what works for you. For the course, at Brighton, we do most of our students are in general practice placement in year 1 throughout the entire year. But we deliver all the teaching in year 1, so that really by the time students start in the hospital placements, their knowledge is there. They've had knowledge and teaching across the board. I'm going to put this question to you guys first about why did you choose to be a PA? Why did you go PA school?
Okay, I'll go first. I knew I wanted to work in medicine, but I also knew I didn't want to be a doctor. And so this has been something that had been a difficult thing for me, because the PA course didn't exist when I knew this. So I was left, not actually working in medicine at all and working in something entirely different. And then when I was told about the PA course, I realised that this was perfect for me. Because I have children, so I knew that the standard medical career wouldn't work for me with having to move around, and also studying for 5 years. It's just prohibitive for me, not working for 5 years and the cost involved in that. And when I heard about the PA role, I just realised that this was perfect for me, and it was just 2 years, and I felt like I could do it, and I'm really lucky to be offered a place, and I'm really happy I made that decision.
How about you, Tom?
Yeah, I would say I was always interested in sort of biology, chemistry. I never had the immediate need to go into medicine. So I initially studied a biomed degree because I thought it was quite sort of generic. It was a good sort of solid scientific foundation. Soon realized I didn't sort of want a job in a lab or maybe to go into academic jobs. Knew that I wanted something a bit more fast-paced, a bit more clinical and working with people. Initially, I did consider graduate entry medicine, but I think once I heard about the PA program, it was definitely a must for me. One, as I've said, it's such a new role. You can really go into the specialty that you want and carve out what you want to do. It's much shorter. You can get into that specialty much quicker. And as Karen said, the work-life balance is so much better compared to a junior doctor that's rotating every 4 months, whether that's in a hospital or across the country. It seemed like just the best fit for me.
Great, thanks. And I would say, sorry, Mary, that I don't think you could hear Tom. Just, for me, why did I become a PA? I actually had a slightly different background. So, I said I have a degree in German and did a lot of administrative work prior to becoming a PA. And I actually got involved because I was doing a bit of homeopathy, so a bit of alternative therapies. And I said, I'd really like to do this. And my son's pediatrician, who also did homeopathy, said, you need to pair it with something medical. Why don't you be a PA? And I said, what's that? And at that point, there had been PAs in the US for over 30 years. And I said, oh, okay. I looked into it and I did it. Best thing I ever did. So I think people can come from a variety of backgrounds, and that's really important. It really adds to the mix within a group of students. So is PA a postgraduate degree? So for the vast majority of programs are postgraduate, and you have to have an undergraduate entry. There are a few programs that take start in undergraduate, but not many. And it is really, so we'll see what happens with regulation next year. And describe your day as a PA and roles and responsibilities. So I can say so I've always worked in general practice, and I had a full clinic schedule. So I would have, if I had routine appointments, so not urgent on the day, but my routine appointments were 15 in the morning and 16 in the afternoon, just the same as the doctors that I worked with. And I would see them in 10 minutes. Never expect any new graduate to do ever, because that's a lot of patients. So, and I did that basically 5 days a week. So I was seeing, upwards of 150 some odd and over a week, and over 600 a month. As I said, I did all the minor surgery in my GP surgery. I arranged all of our education sessions. The thing is, there's not a limit for PAs. We really we can do almost anything. We can help fill the gap. There are PAs who are now partners in their GP surgeries. There are 3 that I know of in the UK, which is very, very exciting. So it's basically seeing patients and then reviewing medications. So yes, we cannot legally prescribe, but we still have to have strong pharmacology knowledge. So it's talking to patients about their medications. And then if you work in hospital, it's very different. So you would go on ward rounds, you would clerk patients, you would do the job. So cannulating patients or taking bloods and getting them off to the lab. Or we can't request any ionizing radiation at this point. Again, that's a legal issue until we become regulated. So that will resolve sooner than the prescribing. So hopefully that answers a little bit. So Simran, it's really a life science degree. So whether that's, I think biomedical science is probably one of the preferred courses for you, but if you want to do human biology or physiology, but it does need to be a life science and not a social science, because it's incredibly intense, and you have to have that very solid life science foundation to get through the course.
I think most of our cohort have a biomed degree, but I have biological sciences, and there's a few other. Someone's got neuroscience, and someone's got embryology. So there's a bit of leeway as to what degree you have, but life science.
Absolutely.
I would say, as someone who studied biomed, that I did find it was very, very useful. It's a good mix of solid biology, solid sort of scientific foundation with a mix of some medicine and clinical things in there. So yeah, but as Naomi said, there's such a vast difference in our course, and you should be fine.
Great. Some programs I think are asking for aptitude tests, but I would say the vast majority do not have those aptitude tests as requirements for getting into the program, and opportunities to specialize. So yes, but it's not like being a doctor. So if you work in dermatology, then you absolutely have fantastic dermatology knowledge, but you still must maintain your generalist knowledge and skills. And the reason for that is, the example I gave, where if you work in trauma and orthopedics, yes, you're going to know a lot about that. You may actually scrub in and be first assist in theater. However, the patients are there on the wards and they need to be taken care of. And so having your generalist knowledge, the patient comes in with diabetes or hypertension, actually you are the person who has that generalist medical knowledge, and you may be the one who's making those decisions to care for the patients. So yes, you can, but you are a generalist with specialist knowledge. Let's put it that way. How many people apply each year? That is very, very different at every university. So at Brighton and Sussex this year, we've had about 130 applicants, and we only take 20 students. So, it's been sort of 1 in 6 or 1 in 7 will get a space. We interviewed a little over half of the ones who applied. And so, but there are some courses who have, huge numbers of applicants. And the ratios will depend on where you are and how many students they take. other questions. If you want to know more about the profession, then certainly going to the Faculty of Physician Associates website is a good place because there's lots of information there.
Karen, can I ask a question?
You go.
Sure.
I was wondering where you, if you want to share with us, like where you think the role will develop in future.
Sure.
Where will PAs be in future?
Yeah, so I think that PAs will become more involved over time in higher level. So I expect PAs to be working within Health Education England. We're already at pretty high level. So, we're involved in discussions with the General Medical Council. And as I said, there are PAs who are partners in their GP surgeries, PAs who are involved in education, PAs who can be involved in policy setting. As a PA, the way I practice medicine in this country is the same way I practiced medicine in the United States before I moved here. I can't sign my prescriptions here or x-ray requests, but that's the tiniest part of what I do as a PA. But the act of practicing medicine is the same here as it was there. And so I think, PAs are becoming much more respected within their field. And the longer people are exposed and work with PAs, the more they realize how much we can contribute. And so the walls that might have been there previously are just being broken down, and the resistance is much, much less. And so it's very heartwarming to see how far we've come in a relatively short period of time. There's a question about the PG dip. It doesn't really matter. So all the difference between the MSc and the PG dip is that you write a dissertation. And so some places think that it's too much to ask for to write that within the 2 years, but all of the students at Brighton did it, so they're done with that. They did it was a service improvement project, so it had direct outcomes for the places that they did that project. It is, it adds another another chunk of work to doing the PG dip. But for the postgraduate loan scheme, that is for master's courses. It doesn't say master's level, so that's really the only difference between the PG dip. As far as employers go, I have never heard in this country that anyone is preferring the master's over the PG dip. You're still a qualified PA. As long as you pass the PA national exam following your university, then you're a qualified PA, whether or not you wrote a dissertation during your program. So I wouldn't let it stop you. You need to pick the program that's right for you rather than whether it's a PG dip or an MSc. So yes, so can you do research alongside being a PA? You bet. So I worked at another PA program for a long time, and one of the graduates from there went straight into cardiology and split his time between cardiology, clinical work, and research. He came with a very strong research background, actually had a PhD before he became a PA, so that was a perfect fit for him. How much is it to sit the national exam? I think it's currently $550. You guys would know because you just paid. I think $550. It's a 2-component exam, and that is run completely separately from the university. That's run through the Royal College of Physician Assessment Unit. So, any final words from our students who thank you so much for giving up part of your Saturday?
Welcome.
That's fine.
Yeah, just finally for me, on my clinical placements, I noticed that pretty much every consultant that I was under in every department wanted to employ PAs. So I think it's a really exciting career to be involved with. I think medicine now seeing the value of PAs and the consistency that we can provide on the wards or in general practice. And so it's definitely an exciting career to get involved with.
Thanks, Naomi.
Yeah, I would say the same. Everywhere I've been on placement, I'm always picking up bits. And I'm like, oh yeah, a PA would fit there, or I can see how a PA would work there. One key point I would say is really do your research, really know what a PA is and how it's different to a doctor. Don't just apply to the program as a backup. Really have it clear set in your mind what you want to do, and this is what you want to do.
Great. Thanks, Tom. And Mukti, yes, there will be, I understand from the UCAS discussions we've had, it will be a limit of 5 places, as it is for other courses. So great. Well, thank you all so much for joining us today. And, you know, you can always put questions on, you can go to the Faculty Physician Associates website to get a lot of information.
Thank you so
Great.
much.